Welcome to Good Life, the health show with me, Puja. Well, viewers, today we have with us Dr. Ashok Khurana, who needs no introduction. Dr. Ashok Khurana, a name who needs no introduction in the field of radiologist. One of the most learned and ultrasound expert in India and world, Dr. Ashok Khurana is the mentor emeritus of Society of Fetal Medicine. Dr. Ashok Khurana commenced his medical studies at the All India Institute of Medical Sciences, New Delhi in 1975, and after completing his MBBS, went on to do a postgraduate degree in radiology, which he completed in 1984. Dr. Ashok Khurana has to his credit several academic and technological firsts in the city, including transrectal scans, transvaginal scans, color Doppler, 3D and 4D ultrasound, and ultrasound guided surgical procedures. He has also conducted several training workshops and chaired several scientific sessions on fetal medicine. So, let's hear in from the man himself how he met ultrasound and never looked back. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Dr. Ashok Khurana, for joining to Good Life, the health show, and it's a privilege to interview with you. Now, I would like to ask you at first that how did you meet ultrasound and never looked back?
Well, it's not a long story. Ultrasound came into the world in the late 50s, but changed radically in the late 70s because computers were added. And when I moved into the field of imaging, which is radiology and imaging, where this is a very important part, I realized that it came naturally to me.
Okay.
It was something which I got a chance to pioneer in India. I was amongst the first to be formally trained and then practice it in India. And there really was no looking back, not because it was a conscious decision, not that I had to think about it, but it was just something natural. And I did realize that even then, when I had that feeling in me that we need something that has to be specific for our population to deliver a service where the cost is not high, which can be taken easily to the people, gives you a huge amount of information, saves lives and enhances lives. All of this rolled into one came at a time when I was fascinated by technology. And so there's no question looking sideways, there's no question looking back.
Okay.
And I knew I had found my following.
Okay, so you knew that you have found your following. Now tell us something about the evolution of ultrasound technology, Doctor.
Well, that's a long story because it started in the World Wars, where people understood how bats communicated and how they were able to navigate through a room with sound. And this was high frequency sound that bats produce, and then it comes back to them. And it actually has a signature of what it has encountered. And the same thing was then used by the Navy to detect submarines. It was used by people who were making railway lines to make sure that those were welded properly. And then emerged this absolutely wonderful story of the fact that we realized that when sound passes through the human body, and it's high frequency sound, the body tissues give a signature that a doctor can recognize.
Okay.
So you can tell what is normal, you can tell what is abnormal, you can tell what's cancer, you can tell what's not cancer, you can tell what's happening to a pregnancy, and of course it's used for care of male patients as well.
So a lot of things can be detected through ultrasound, indeed a magic that has been created by experts like you. Now Doctor, you also had the opportunity to train at the ultrasound department of Herlev Hospital in Denmark. So tell us about that experience as well.
Yes, so when I came into ultrasound, there wasn't a machine in India. I was the first to use one at the All India Institute of Medical Sciences.
Okay.
And we did realize that we needed training. And so my Professor Sneh Bhargav, who is the guru of radiology, and ultrasound is a part of radiology, she said, well, you try and see what you can learn from him in a week, but I think you need to go for training. And she pushed me into it. And I said, I can't afford it. She said, I will arrange a scholarship. And that's where the story began.
Okay.
So we got a machine for our department, and then I went on for training. It was the first structured training, and it was very hands-on training, and that's where I learned how to do ultrasound. I learnt it before, but it got refined when I worked there, and I could bring it back here and adapt it for our own population.
All right. Now, Doctor, you have also authored 2 medical textbooks. Now, one on 3D and 4D ultrasound and the other on breast ultrasound. So, what do you want to tell on that as well?
Well, that was the era of textbooks. Excuse me. It was believed that if we read a textbook, we could learn, and so I said, let me write textbooks. There weren't too many textbooks on new technology, and breast technology was new, and the 3D, 4D technology was new. And in those days, technology didn't get outmoded so fast, so we got away with it. And so it was nice that somebody could actually open a book and see what was happening in the last 10 years and then adapt it instantly to their daily practice.
Okay.
But what really happened was that soon after I wrote those books came the 2010s, where technology changed every second. Now, if I get a textbook ready, it's outmoded before it's printed. So the world has changed.
World has changed,
Yes,
and technology
yes.
has also been changed, and it has been upgraded time and again. Now, if
Hugely,
yes. If we want to know about the big ultrasound innovations in near future, what are your plans? What are the plans like? It has been working out. Now, what are the innovations that has been planned for near future?
So the big new is artificial intelligence.
Artificial intelligence.
Yes. So what we do is that machines are trained to do the simpler tasks,
Okay.
so that somebody like me and my colleagues can do the more complex tasks, and we can also supervise the machines. So we've reached a stage where there has been a lot of machine learning, there's been a lot of data that we've been able to use, and basic tasks are now looked after there. And importantly then, we then have a much more efficient workflow.
Okay.
So that's the big new thing. The other thing is that technology becomes cheaper in a few months after it's introduced. So it's very, very friendly to developing economies like ours.
All right.
And those two things have made sure that this is a technology for the people and of the people.
Okay. Now, Doctor, workshops and seminars. Now, we have also seen that these workshops and seminars also helps a lot. You have also conducted quite a lot. So, how do you think these workshop and seminars on ultrasound technology helps the people to know about the evolution, to know about the emergence of new technologies being lined up for our future?
Yes. So you see, when you skill somebody, you make sure that there is optimal use of technology. The tragedy is that you can buy a fancy machine, not know how to use it, and it's just like the technology of old times then, because it's being underutilized. So when we do these skilling programs, that's where we take people to. We take them to the cutting edge, so they're familiar. We reinforce the basics, so there's a wonderful clinical service, and all the shades of grey in between. So everybody is well served.
Okay,
Yes.
okay. Now, international and national conferences, medical conferences, you have attended a lot and conducted a lot. Tell us some experience you would like to share with our viewers at this point in time.
The first piece of good news is that when it comes to translating the use of technology for people, India is perhaps ahead of the rest of the world. Every time we think that our developing economy, poverty, etc., no. That is not where ultrasound is today. Ultrasound today is a people's technology, a people's health technology. It makes sure that you have a very efficient outcome, and that is the great thing about ultrasound today. That in India, ultrasound is way ahead of what it is in the rest of the world. 100 marks out of 100 for us.
Okay. Now, would you like to also share about your initial days you have spent at AIIMS as well?
Yes. So the good thing about AIIMS was that it wasn't conventional.
Okay.
So if you wanted to do something and you wanted to be innovative and you wanted to bring in something new, the ambience existed both psychologically as well as physically to be able to do it. And always there was this pathway to success that was facilitated by all my colleagues there. Seniors, juniors, equals, from the cleaning staff to the professors, they were always there to help.
Okay.
And that's how everything evolved. It was just fantastic. There was this ideal situation where you could work under perfect conditions and make sure everything worked out well.
Okay, so how you are with your colleagues and also with your team, because a good team always works when your mentor is like ease to them and also helps them with every nook and corners and also with the confusions which arise in their mind. So a bit of like a extra question for you, like how are you with your team? Are you strict?
So I'm not with one team, I'm with 150 teams, I'm with 1,000 teams.
Absolutely.
And I don't believe that a leader can lead from the front or a leader has to push from the back. I believe that you have to fill in the gaps. So if somebody requires to be led, we lead. If someone needs a push, we push. And what I like most is to work together as equals. We have this tendency in our part of the world that someone is better, someone is not so good. That's never true. Somebody is always better than somebody at something. We also have this that someone is junior, someone is senior, and so on. There's a feudalism. The moment you throw out the feudalism, it works out very well. We're all equal, we're doing great work, and we're able to improve the health of our people in the best way possible.
Now, how has things changed like when you started and now when the technologies have advanced a lot? What do you have to say on this?
Advancing technology has been very useful. So we have a more specific diagnosis. We can follow our people, we can predict disease, and it is done efficiently. See, the most important thing is that everywhere in the world you don't have unlimited amounts of money to spend on health.
Right.
You need to make sure that from whatever is available you make the best of it. And that is what new technology is all about, that you have great technology, expensive for a short while, but then it finds its own level.
Okay.
And you translate that. And it works out well.
All right.
That's the important bit.
Well, viewers, it's time now to slip into a short break, but do come back soon because we have lots more on the other side. Now, what would you like to tell about fetal medicine, like the term, which is being very much familiar nowadays? Now, what is the term? What would you like to tell our viewers? Because they will have a notion to understand about fetal medicine.
Yes. So fetal refers to the unborn child, the fetus, and medicine is the science and art of medicine to diagnose and treat problems of the unborn child. And that is where fetal medicine came from. We did realize that in a pregnancy, it's never the mother who's the patient.
Okay.
We have the fetus as a patient. And that was our so-called slogan, if I may call it, 20 years ago. The fetus as a patient. We'd replaced sheep with real human beings, unborn human beings, and that's where the roots came. And ultrasound is a very important part of the technology. Standard basic healthcare is a part of that technology. Genetics is a part of that technology. Everyday care is part of that technology, and community programs are also part of fetal medicine. So that everybody gets a basic minimum. Everybody who needs extra attention will get what they need, both in terms of diagnosis as well as treatment.
Okay.
And so that's what is fetal medicine.
Okay. If we talk about fetal medicine in the Northeast context,
Yes.
Assam-centric, so
Yes.
how you see around this?
So there used to be a paucity of this field, and when we did found our Society of Fetal Medicine 11 years ago, we decided to take this message to our colleagues. And it wasn't easy because people thought it would be expensive, it would be a specialty, but then we realized that we can translate that into everyday practice.
Okay.
That's where we are today. Now, in terms of the Middle East, the Northeast, my apologies, we do understand that there are two major advantages here of bringing people at par with world technology. The first is that there is a degree of education which does not exist in too many parts of India.
Okay.
So people are willing to do that. The second thing is respect for women. There's a lot more respect for women in the Northeast compared to many parts of the country. And the third thing is that in many areas, especially the remote ones, there is a matriarchal society. All this has made sure that the message of fetal medicine is moving much faster into the periphery compared to many parts of the country. So we have truly realized that the statistics here of women or children who die or are damaged in pregnancy is reducing, which is the aim of fetal medicine, and that the improvements are at a very rapid pace. It's a very satisfying pace that we see here.
Okay, so do you think that there is a lot to do to spread the message of fetal medicine in the entire Northeast as well? Does it need more time?
Yes, you're right. There is a lot that needs to be done.
Okay.
But we have realized that what we've done already has been very satisfying and very rapid. It's just taken over, and it's been accepted by the community very easily. It's shown results very easily, and the acceptance at the personal level, at the government level, has been much more than in other parts of the country. So it's, yes, of course, like in every place in the world, there's a lot to be done. But with a minimum of effort, a lot has been achieved.
All right, Doctor, I know you are a busy man today, so but I would like to ask you that what the viewers who are watching our show, what message do you want to give to them regarding the ultrasound, regarding the possibility and the confusions which create in their mind regarding fetal medicine as well, which is being, the message is being spread now?
Yes, so we understand that this is, every technology is a double-edged sword. We do realize that yes, we must do this for the mothers, we must do this for the babies. It can be misused. People might decide, for instance, that if there's a minor abnormality which you can live with and have an excellent quality of life, they may not want to continue with that pregnancy. That's not so nice. However, on the other hand, there's so much more that has been done to improve the standards of health that really speaking, that is where we are today. That this is a people's technology, it's always going to be there. There is hardly any downside to it, there's only an upside, and it's easy to achieve.
And a psychological problem also has been created these days. So on that note, do your team also help them with the psychological part? Because the patients have a lot of confusion in their mind that will this thing work out or not?
Yes. So, you know, it's like anything new, there is Google. And Google, unfortunately, is something that creates confusion because people don't know how to use Google.
Absolutely.
You don't know who's written what and how. Is it somebody from a university?
Which website to follow or not.
And what to follow, what to believe. So the best thing is that we now have these fetal medicine clinics in almost every university hospital, where you can go and ask these questions. And when you look at Google, you must know that anything that's more than 3 years old is not of relevance today. It's outmoded technology. And we try and sort that out. And we also like to make sure that all professionals, which is not just doctors, but paramedics, nurses, neonatologists, people who look after newborns, pediatricians, people who handle baby hearts, people who handle baby kidneys, people who handle baby surgeries, pediatric surgeons, are all now educated, they're all skilled, and we all work together and make sure that these doubts in people's minds get cleared. So it's worth it consulting a professional. And the other side is that we've started educating people at the very basic level, such as our ASHA workers, such as our nurse midwives, to make sure that even people who have no access to anything but television and Google and WhatsApp will no longer have misinformation, but correct information.
Absolutely. Thank you so much, Dr. Ashok Khurana, for giving us those valuable information at this point in time. I'm sure the viewers will watch our show must be benefited with the answers just Dr. Ashok Khurana gave you. And thank you so much once again for joining to Good Life, the Health Show. Thank you so much.
Thank you indeed.
That's all we have for you in this episode of Good Life, the Health Show. Keep watching Northeast Live. Goodbye and take care.